Starting 2 weeks prior to surgery, we recommend patients avoid taking aspirin, NSAIDs, or any blood-thinning medications. Now, if you're prescribed an anticoagulant medication for a cardiac condition, we don't want you just to stop your medication. You should consult with your cardiologist or prescribing physician. Let them know you're having a planned surgery so they can weigh in on whether or not it's safe for you to pause this medicine, and if so, for what duration. For general aches, pains, cramps that you may encounter during the 2 weeks leading up to surgery, don't reach in your medicine cabinet and take NSAIDs. You may better know these as Aleve, which is naproxen sodium, or ibuprofen, which is Motrin. If you aren't sure if you take NSAIDs or blood-thinning medications, talk to our clinical team at your preoperative appointment, and we're happy to guide you. The take-home point is that if you do need a pain-relieving medication prior to surgery, Tylenol or acetaminophen is always safe to take. Now, let's talk about over-the-counter vitamins, minerals, and supplements. The easiest and safest thing to do is just to stop these optional medications 2 weeks leading up to surgery. But at minimum, you need to stop all herbal medications, including herbal teas, in addition to vitamin E, fish oil, and omega-3 supplements. Diet pills such as phentermine should also be stopped 2 weeks prior to surgery. Stop smoking or using any nicotine-based products at least 2 weeks before surgery. Best practice would be to stop 4 to 6 weeks prior to surgery, as nicotine reduces blood flow to the skin and can delay your wound healing. After your preoperative visit, we assume no news is good news. And what we mean by that is if you don't call and tell us that you've come down with a cough, cold, pus, boil, flu, coronavirus, we assume you're doing great and marching towards surgery. It's your responsibility to let us know if anything changes between then and surgery. That way we can make sure you're the most healthy version of yourself going into surgery.